30 milligram per kilogram per day in 4 divided doses. That is 15 milligram per kilogram every 6 hours. Is it clear? So that's how you give paracetamol when you want to reduce the fever. Now, in a case where there is hypothermia, you have to cover the child. Is it clear? The next case also is going to be uncompliance to medication. I've completely forgotten to talk this about. This is one of the precipitating factor. Uncompliance to medication. Is it clear? Uncompliance to medication is another risk factors for sickle cell to have crisis. Particular medication where they can be uncompliant to is vitamin B9 and B12. Is it clear? Vitamin B12. Normally, patients that have sickle cell should take 0.4 milligrams of vitamin B12 as prophylaxis per day. Is it clear? But now, if they don't take this amount or they don't take it at all, you are going to have generally you need to know that they have chronic hemolysis and they have to take vitamin B12 to do a compensatory regeneration of the red blood cell which is being hemolyzed. So in this case, when they don't take vitamin B12, there is a consumptive vitamin B12 disorder, and then they are going to suffer, in addition of their chronic hemolysis, they are going to have a macrocytic anemia, which is going to proliferate, which is going to increase their crisis. I forgot to speak about the uncompliance to medication in their precipitating factor, which is there also. Is it clear? So you always give to have this, give this medication to the patient with sickle cell. And then the fifth element is that patient with sickle cell should never be dehydrated. Is it clear? So how do you treat it? You have to do the rehydration protocol. You need to know that there is a protocol of rehydration in patients who are sickle cell. Is it clear? And the rehydration protocol is that you need to know that in patients who are not anemic, is it clear? That is, their blood is going to be greater than or equals to 8 grams per deciliter. We use 3 times the body surface area for the rehydration. The rehydration volume, the liquid, is going to be 3 times the body surface area. But now, if the patient is anemic, the liquid is going to be 2.5 times the body surface area. That is how we calculate the fluids that you are supposed to give to the patient. Is it clear? That's how we calculate the fluid that we give in the patient. Now, we need to know that the body surface area can be calculated in 2 ways. Is it clear? So the first way to calculate the body surface area is equal to the 4 times the weight of the patient. Is it clear? It is 4 times the weight of the patient in kilograms plus 7 divided by the weight in kilograms. The weight in kilograms plus 90. So that is how we calculate the body surface area. That's one method to calculate the body surface area. So let's say that the patient is 30 kilogram and is 10 kilogram and is not anemic. It means that they're going to give him 40 plus 7 divided by 100. That's 10 plus 90 is going to give you 47 divided by 100. Is it clear? 47 divided by 100, which is equal to 0.47. 0.47 is going to be the body surface area of a patient that is having a weight of 10 kilograms. Now I take this 0.47. If the patient is not anemic, we use 3 times body surface area. If the patient is anemic, we use 2.5 times body surface area. So let's say that the patient is not anemic. So you're going to say 3 times 0.47, and it's going to give you the volume in liters that you are going to give to the patient. That's why I put initially and earlier. Is it clear? So give you the volume in liters. So that's how you calculate. Another way to calculate the body surface area, is it clear, is by using the Montelar's formula. Is it clear? It's by using the Montelar's formula. And the Montelar's formula is equal to the square root of the height in centimeters. The square root of the height in centimeters plus the weight times the weight in kilograms divided by 3,600. So that is another method of calculating. So let's say that in this case the child has a length a length of 100 centimeters and has a weight of 10 kilograms. Ezekiel has a length of 100 centimeters. He has with 10 kilograms is too small for. Let's say he has a length of 100 centimeters and a weight of 20 kilograms, Ezekiel, so or 30 kilograms, and then this is 360. So the body surface area is just going to be equal to the square root. The height is 100 centimeters. The weight is 30 kilograms divided by 3,600. So it's going to be the square root of 3,000 divided by 3,600. Is it clear? So that is how you calculate for the body surface area by using the Montellas formula. Is it clear? I think the Montellas formula is even more explicit than for the body surface area calculation than the pediatric body surface area calculation, because it also include the height, and the measure of the body surface area include both the length and the width. Is it clear? So that's how you can calculate a body surface area, and you need to permutate in this formula. Is it clear? For you to have the volume of the liquid in liters. Is it clear? So now, after evaluating for that, we need to know that what we have new protocol in the management. Is it clear? In the management of sickle cell, de novo management. Now, for the de novo management of sickle cell, we have what is called hydroxyurea. Ezekiel hydroxyurea, and you need to know that in patient that has sickle cell crisis of greater than or equal to 3 crises per year, if they are greater than or equal to 3 crises per year, they are going to be managed upon with hydroxyurea. So that is an indication for managing hydroxyurea. Another indication for managing hydroxyurea is when a child already has one event of acute chest syndrome. If a child has one event of acute chest syndrome, he is managed with hydroxyurea. And now the complication, the side effect of hydroxyurea, we have two major side effects. The first side effect is going to be infertility, and then we have bone marrow toxicity. Those are the two major side effects that you have in the case of the usage of hydroxyurea. Is it clear? So now, after the usage of hydroxyurea, you need to point out that we have other upcoming management. Is it clear? Now, this other upcoming management consists of one, bone marrow transplant is another upcoming management, and then the second one is gene therapy. So those are other upcoming management for sickle cell anemia. Is it clear? So after this, we have already visualized everything in sickle cell anemia. So you say thanks for your kind attention. We now continue with follow-up.